You may be one of the millions of men who suffer from the troublesome and often disruptive symptoms related to BPH, benign prostatic hyperplasia. This educational video will teach you about BPH and its symptoms, as well as the most common treatment options available to you, including medication, in-office therapy, and surgery. This video is specifically designed to educate you on Prostiva RF therapy, an in-office, single-treatment procedure which is proven to be a very effective option for men experiencing moderate to severe BPH symptoms. The men you will meet in this video are actual Prostiva RF therapy patients. We hope the candid accounts of their experiences before, during, and after their procedure will provide you with valuable insight into the significant benefits of in-office BPH therapy. These patients were not reimbursed for their testimonials. Their statements solely represent their opinions and understanding of their specific medical condition and treatment. The physicians you will meet in this video are very experienced professionals who have treated numerous BPH patients with Prostiva RF therapy. They will share their professional opinions on safety, effectiveness, and long-term results of the procedure and explain what you can expect if you choose Prostiva RF therapy. BPH can significantly affect quality of life due to bothersome symptoms such as repeatedly waking at night to urinate, frequent daytime urination, urgency to urinate, and interference with sexual activity. If you suffer from BPH, you know from personal experience how dramatically it alters your everyday life. Waking several times during the night to urinate may already be impacting you and your partner's ability to sleep. During the day, you may be constantly on the lookout for a restroom, making it difficult to perform your job or just relax and enjoy social events. Intimacy with your significant other may be difficult or even impossible.
Most patients who come into the office are already starting to experience some symptoms of prostate growth. And what I tell them is that the average prostate starts to grow at around age 25, and it never stops. And so from that point on, the degree of symptoms that a patient has will continue to increase until it gets to the point where patients begin noticing a significant change in the way that they urinate. That may be a slowing of their stream, it may be waking up at night, it may be rushing to the bathroom because they have to get there quickly. And so we'll talk about what the prostate actually does, and the reality is prostates only have one function, and that's a reproductive function. Once we've passed that point in our lives, there's no real benefit to having the prostate. Ultimately, it gets to the point where patients become very cognizant of the symptoms that they have, and it gets to the point where they come in to see a urologist to see if there's some type of relief that we can offer.
The difficulty in urination and the frequency really affected me from a social level, because every time I was in a social setting, I was rather embarrassed to ask where the restrooms were. When I was driving to a destination, I would panic because I would have to urinate frequently, and it was extremely difficult, oftentimes, to find a place to do it. So I knew then that something had to be done, because I was actually in agony over this situation, both physically and psychologically.
Well, my symptoms prior to the treatment was frequent urination. Almost, it seemed like hourly during the day. I had to get up. I work in an office, so almost hourly I would go to the bathroom, have to urinate. For me, it was very difficult to even start the stream. It was restrictive. I just would take a long time. It was just very uncomfortable. That was just during the day. At night, I would get up probably 4 to 5 times during the night to go to the bathroom.
BPH is common to more than half of all men over age 50. It is a non-cancerous condition in which the prostate begins to grow as a normal part of the aging process. The prostate gland, located just below the bladder, is about the size and shape of a walnut. The primary function of the prostate is to produce semen, the fluid that carries sperm. The prostate surrounds a portion of the urethra, which is the tube that carries urine from the bladder out of the body. When the prostate becomes enlarged, it compresses the urethra, causing difficulty with urination.
I think it's important for patients to realize where the prostate is, what it does, and how it affects the bladder. I find it easier to explain to my patients what's going on by actually drawing pictures for them. This is the bladder here. The water channel comes out like this. and the prostate sits right here. So the prostate sits right below the bladder and the water channel goes right through it. Imagine the prostate being a donut and the water channel being the hole in the donut, and that donut sits right below the bladder. Well, as the prostate gets bigger, just like when a donut gets bigger, the hole gets smaller, and that starts restricting the flow. The bladder is just a hollow muscle, and the function of the bladder is to store urine and empty completely. As you develop some obstruction, the bladder can get stronger. But once the bladder gets as strong as it can get and your obstruction worsens, then the bladder can start undergoing changes and damages, and that's when patients become symptomatic.
Enlarged prostate is not life-threatening. However, if left untreated, it may lead to more serious health problems over time, including urinary tract infections, bladder stones, blood in the urine, incontinence, decreased kidney function, or urinary retention. Urinary retention is the sudden and complete inability to urinate and can occur when the obstruction from BPH blocks the urethra and it is no longer possible to empty the bladder. If retention occurs, emergency medical intervention is required. In rare cases, permanent bladder and/or kidney damage can develop from BPH. Today, the most common treatment options for BPH are medication, surgery, and in-office therapies such as Prostiva RF therapy. Drug therapy is often the first line of treatment for BPH and is frequently used to control mild to moderate BPH symptoms. However, research has shown the medications are only effective in about half of the patients who are currently taking BPH drugs, and some medications can become less effective over time. In addition, medications can have significant side effects such as fatigue, headache, dizziness, erectile dysfunction, and loss of sex drive. Finally, medications can be expensive, and those costs will be incurred for the rest of your life.
One of the most common ways of treating BPH in the early stages is with medication. Medications that in large part try to reduce some of the muscle tone in a prostate so patients can urinate more easily. And while in the initial phases about half of patients will have some positive result, we all know that taking medication typically comes at a price, and that is some side effects. So some of the more common side effects that we see with medications, and the reason that patients can't stay on them for too long, are feeling very tired, having a stuffy nose, having changes in blood pressure, seeing a change in sexual function, and seeing something called retrograde ejaculation. Over time, another issue with medication is the cost involved. Taking a pill every day, 365 days a year, over many years becomes a very costly proposition. There are now ways of treating prostate enlargement that do not have the side effects of medication and come at far less cost and allow patients to resume normal activities very quickly. It also eliminates the need to remember to take a pill every day.
There are two main categories of medications for patients for enlarged prostates. One is our alpha blockers, Flomax, Tamsulosin, medicines similar to that. Those medicines, the longer you take them, the less effective they become. The prostate continues to grow, and also they lose their effectiveness as far as being alpha blockers. They also can have considerable side effects of what we call postural hypotension. That's when a patient's laying down or sitting down and they stand up very quickly and it drops their blood pressure. So that can be a serious side effect. The other classification of medications, Avodart, Proscar, finasteride, medicines such as that, are intended to shrink the prostate. Sometimes they do, sometimes they don't. But the longer a man takes that classification of medication, the more chance they have to get erectile dysfunction.
At that time, I was on two different types of medication, Avodart and Flomax. I was on those medications for about 6 months, and though they did take care of the symptoms, no medicine comes without side effects. The ones that I remember, there were some sexual performance issues related to the medication, and I was so glad that I had the procedure done so that I could get off of those medications and have things get back to normal.
When I first found out about having this problem, I was on the medication Flomax, which seemed to help to a point, but not to the point that I would have wanted it to. I had a real problem with having to take pills because I'm not really good at remembering that type of stuff.
In the past, surgery was another common treatment for enlarged prostate. But today, surgery is usually indicated for more severe symptoms, or is recommended if there are complicating factors such as frequent urinary tract infections. kidney damage from urinary retention, blood in the urine, or stones in the bladder, and surgery comes with many risk factors and side effects, including hospitalization, general anesthesia, postoperative pain and discomfort, and bleeding. Today, there is an alternative to taking medications for the rest of your life that does not have the same risks and side effects common to surgical treatments: Prostiva RF therapy. Prostiva is a safe and effective procedure that has demonstrated strong clinical outcomes with proven durability. The procedure can be completed right in your urologist's office and generally takes between 30 and 60 minutes. Prostiva RF therapy requires only oral medication and local anesthesia. No general anesthesia is needed. The doctor will use the Prostiva RF therapy device to deliver low-level radiofrequency energy to the areas of the prostate that are obstructing urine flow. At the same time, cool water is circulated throughout the treatment areas to protect the urethra and surrounding healthy tissue and to increase patient comfort.
The common denominator for all office-based therapies is to shrink the prostate using some form of heat. Prostiva uses radiofrequency waves that achieve a very high temperature in the prostate. The advantage to a Prostiva procedure is it allows the treating urologist to see the tissue that's causing the patient's symptoms and target energy into those specific sites. In doing so, we reduce the part of the prostate causing significant symptoms without causing side effects.
When I'm explaining to a patient how Prostiva works, I go back to the analogy of the prostate being a donut, the water channel being the hole in the donut, and that donut sits right below the bladder. Then I tell them using low-frequency radio waves, basically what we're doing is burning open the hole in the donut, and they understand that analogy quite well.
As far as the pain during the procedure, it was like he explained to me, you're gonna experience these 3 or 4 different like pricking sensations, and that's about what it was. I mean, anything else going on I didn't feel, and I wasn't under a heavy medication, and so that part of it was very simple.
The pain on a level of 1 to 10 was way down, like at a 2 or a 3, compared to, you know, smacking your thumb or something with a hammer, or running your knee into a Johnny ball on your trailer, your truck. It's, you know, nothing like that at all. And then actually it was, and I remember my vasectomy, and it was less pain or pressure than that procedure was.
For me, there was no pain involved in the procedure whatsoever. You will experience maybe 3 to 5 seconds of discomfort. Once the instrument is in place, there's no pain, no discomfort whatsoever.
When the procedure is finished, you will be given post-treatment instructions. Since you were not given general anesthesia, you will be able to go home shortly after treatment. However, because you may have been given medication to help you relax, you must have someone drive you. Most physicians recommend patients use a urinary catheter immediately following the procedure. A catheter will assist the bladder in draining urine while the swelling subsides. Your physician will discuss his specific catheterization protocol prior to your treatment. Patients typically return to normal activities within 24 to 48 hours, and while results can vary, they usually experience symptom improvement within 8 to 10 weeks of the treatment. During the first few weeks after your treatment, it may seem as though there are no changes in your symptoms. However, your body is working on healing itself. The once enlarged prostate is becoming smaller as the excess tissue destroyed by Prostiva is reabsorbed into your body. As your prostate shrinks, the pressure on your urethra is relieved, and you'll see most or all of your symptoms diminish or completely disappear. Once recovery is complete, you should have significant, long-lasting relief from your BPH symptoms without the need for daily BPH medication. As with all medical treatments, there are some possible side effects with Prostiva RF therapy. They include bleeding, blood in the urine, pain or discomfort, urinary retention, urgency to urinate, increased frequency to urinate, obstruction or blockage, or urinary tract infections. Patients may also experience a minor burning sensation when urinating for 1 to 2 weeks following the procedure. These side effects were seen in a very small percentage of patients. If you have any concerns with these side effects, you should discuss them with your urologist. It is important to note that Prostiva RF therapy is covered by Medicare in all 50 states, as well as by most private insurance companies.
After the procedure, I must say that it is amazing how different my life has become. I do not have frequent urination. I do not feel like I can't empty my bladder. I don't have to constantly look for a restroom. And I don't have the panic that I had before of, if I do have to urinate, will I be able to, and where can I? I must say that I would recommend this procedure to any gentleman who has an enlarged prostate, who has had the symptoms that I have had, because it is really, as far as I'm concerned, life-altering.
I was able to really return to normal life. I could go to, say, a sporting event where before every hour I had to get up and leave. Well, I could sit there through the whole event. Playing golf, every turn you had to look for a bathroom, and sometimes you couldn't find a bathroom, and you kind of were tensed all the time. Now I can play golf 4 hours, 5 hours without going to the bathroom. So to me, those are very significant, life-changing events. Even at home at night, having to sleep in a different bedroom so I would not disturb my wife. And now I can sleep in the same bedroom with my wife and resume normal relationship with my wife is just tremendous. So, and this has gone on for 4 or 5 years. And so this procedure really has given my life back.
Prostiva RF therapy is proven to be safe and effective in treating BPH. If you think you too might be a candidate for Prostiva RF therapy, talk it over with your urologist. Together, you can decide if Prostiva is the best treatment option for you.